Welcome to TotalCast with your hosts Alexander McKegg and Jason Rigby, where humanity steps into the future and source data defines the path.
Hey, Jason.
Alex.
I'm a little bummed out with this article we're going to talk about.
I know. I saw it, and I knew you would catch on to a couple things. I sent it to you, and you were starting to rant.
Yeah. What bums me out is they didn't, not once in this whole healthcare article, right? And about the market and like where it's headed. It didn't talk once about the quality of care.
No, it's big data analytics in healthcare, 2020 global market share, segmentation, applications, technology, and forecast to 2026.
Okay. So these geniuses with their crystal balls are forecasting out 6 years. I don't know what is going to happen tomorrow. So any of that nonsense first out of the gate is just absurd, right? And then their forecasts are strictly from a profiteering standpoint. None of it talked about increasing the quality of life.
No, yeah.
Increasing the quality of care. There's nothing about like the efficiency. It's like, oh, we can make the hospitals run more efficient, like a well-oiled machine. And we can do it in the next 6 years by using all this big data. What about making people run like well-oiled machines?
Yes, exactly.
And the article breaks down for the report two things. You have services. Did that just pause? Is it taking photos? We use a GoPro and it takes voice commands. Hold on a second. Okay, we're back. The article breaks down into two separate things. It's service. Where'd you go with the article?
Yeah, I have it right here on my phone. So yeah, it breaks it down into, this is funny.
It's like service and product.
Yeah, and so first I want to make sure that we know the top players.
Yeah, go ahead.
So let's put the top players out there on this big data analytics and healthcare market. Cisco, Cognizant, Healthcare Catalyst, IBM, McKesson.
Yep, McKesson.
Media Analytics, Microsoft, Oracle, SAS Institute, and Vizient.
Yeah.
So those are the ones that, these are the big boys that are playing in this. And we know Microsoft, we did a whole podcast on Microsoft. Market segmentation by type, the product can be split into software, service, and then market segmentation by application split into hospitals and clinics, finance and insurance agencies. That's a big one. Research organization, and then market research methodology. That's what they're breaking it into.
So if we're looking at like the big data, they're splitting it. It's like, okay, we've got two categories here. How do we make more money analyzing information? And how do we make more money selling the product that analyzes the information? That's it.
Yes.
That's where they see the big money. It's like, and then, cool, telemedicine, super cool. We've had video chatting forever. You're just going to put mark the price up, because now we're doing FaceTime with the doctor. Come on. It's not like a new technology. It's not revolutionizing everything.
Right.
They're just trying to find a way to keep people out of the hospital because people are expensive.
Yes.
They're not trying to, it's like, we got to talk about the quality of care of their life. And for the analysis, they're creating all these products, analyzing information that wasn't giving them answers in the first place.
Well, this whole idea of a company having to make money indefinitely.
Yeah.
That's what you're graded on.
Yeah, you are.
Think about that.
And then it's like, how do we project out those earnings? And then how does that come back to the shareholders?
Indefinitely. You need to do this and do it better.
All the time.
All the time.
You can, unless robots run the entire hospital, it'll never be perfectly efficient. So why don't you stop focusing on treating it like a business and start treating it as a place that actually increases the quality of human life? Like it's depressing that their focus for the next 6 years is all about what's a better product or service we can give to analyze information to make this thing a better machine, rather than saying, what can we do with information, people, and the quality of their life over the next 6 years?
I mean, it's just simple things, and I don't want to get too medical with it, but we know blood types play an issue with COVID. We know DNA and genomes are playing an issue. We know Native Americans versus, Black Americans versus, there are so many different variables of how people are reacting to this. Are people taking vitamin D or not? Is that who's come out and said, we've heard all these doctors come out and say you need to take vitamin D. Vitamin D is really important. It helps with your hormones and stuff. But
think about this.
How cheap is vitamin D? Should we be taking vitamin D?
But
how much should we take?
Think about this logically, though. Okay. Who are people that are naturally deficient on vitamin D?
People that don't go outside
and are already sick.
Yes.
Obviously, those people are probably going to get COVID first.
Yes.
It's not vitamin D is the direct thing. See, that's the issue here. When we're creating these products or services like this big data healthcare, that's how they focus and analyze information. That's not the full picture, okay? Because you're not having that direct conversation with that individual. You really don't understand the quality of care of the full life cycle of that person. The products aren't designed for that. It's you got sick. Let's create products that deal with reactive technology.
But when you look at, like for myself with this new direct primary care that I'm going to, and it's a new model and it's being real crazy, they're doing lots of blood work with me, doing lots of preventive stuff like, there's money to be made in all of that.
Preventative though.
There's still, I want people to understand, I may do this Dutch hormone test.
Yeah.
And I get charged $400, $600, whatever. Yeah. I just paid $400 because I want to see how my hormones are reacting and then what I'm deficient in. I didn't even know there's prescription grade vitamins that you can only prescribe and that they're way better than the stuff that's not regulated by the Food and Drug Administration.
That's correct.
So, why isn't all this out there? Why are we just reacting to people's...
The reactive model, we're so used to putting out fires and there's so much money in a reactive model that they're like, why would we want to take a proactive approach?
But I think long-term, because you said life cycle.
Yep.
So if we're going to look at it in a marketing standpoint with a person and the life cycle, like the LTV, the long-term value of that person, if I have them coming to the doctor's office every few months and I'm doing this and doing this, checking this, making sure this is good, doing this test, preventive, I'm having them purchase products through me to be more proactive in their health. I'm checking and saying, well, maybe you shouldn't eat as many carbohydrates, maybe you should eat more fruit, maybe you should eat more, whatever it may be, looking at their diets and I'm getting into this. I'm helping because a sick person can't work very well.
They're sick. And a person that's at 50% is only giving you probably 10% from your work. Yeah.
If we're here in the United States and we're worried about all these other countries, they're going to be, like India and China and all these companies. They're kicking ass and, moving up and then we're sitting here looking at it and we have obesity levels and, the list goes on and on and we're unhappy, depressed, all that. That's the problem that needs to be fixed.
Yeah.
Because when we unite together, as whatever country it may be, look at Sweden and look at their healthcare models and the way that and the time off that they have. Netflix just came out and said you have unlimited time off. You can take as much vacation as you want.
Totally, we have unlimited time off.
And how many people take advantage of that? How many employees are really taking advantage of it? Are people working harder than they normally would?
They end up working harder because they know here's the job that has to get done.
Right.
Someone's offered me the flexibility. That's a more humane model, but I'm willing to work harder for a humane model. If you go to work and you're freaking depressed and you can't stand your job, you're like, I need to use my 2 weeks now.
Yes.
And you're calculating how I can get the most value out of my time off. It's like, you shouldn't have to live your life like that.
Right.
That's a reactive approach to life. So when we look at, this big data in healthcare, we need to take a proactive approach with big data in healthcare. And proactive is looking at the life cycle of the person, the quality of life, the quality of care, not just saying, here's a new telemedicine system, right? And here's, we're going to analyze this information or, the efficiency of the hospital from an accounting standpoint. That doesn't help people live.
No.
Okay. Helping people live is taking big data and analyzing all aspects of their life and their behaviors, and then affording them the best options, education, and information so they can make the right choices.
Yeah, because you take somebody that, let's use cancer, for instance, and they've gotten cancer because of poor choices or whatever. Maybe it's genetics, who knows? And they die at 65.
Yeah.
If they would have lived to 90 and you would have been able to bill them for all this proactive healthcare, you see what I'm saying?
Yeah.
That life cycle would have been longer. And it would be interesting to see a study of this. How much money you would have made over to that person or piece of cattle. If
that's how they treat people.
Yeah. But how much money you would have made over 90 years instead of 65 years, and then basically waiting till they get sick, and then you're making all these hundreds of thousands of dollars over these cancer
Yeah,
treatments.
only at the
Could you have
only
made
at that
more
point.
by having them, because if you're going to be proactive, you're going to see the doctor more.
Of course you are. I don't want to see the doctor.
Right.
And I know there's a lot of people in the same boat as me. They don't want to go into a hospital because then when you go in, you're probably going to get sick. Someone will probably find something, right? The probabilities are higher.
Yeah, but I mean, like my blood test the other day, she spent 45 minutes with me, and she's like, you're low in vitamin B6, and vitamin B6 causes this, this, and this. We need to get this. You need DIM, which is going to help you with estrogen levels because you're older now. Testosterone levels are here. All this stuff. It's like, if you would have stayed at these lower levels, who knows what would happen to me 10 years from now.
Yeah, what are the long-term effects? The thing is, you're taking...
But I'm purchasing product and paying her money now, where if I wouldn't have paid her any money, and I would have waited till I got sick at 60.
And then you're like, I got to get fixed right
Yes.
now. And then everything becomes wildly expensive.
Because there's abundance in it all.
Of course, yeah.
We're not taking away because we're eliminating disease.
No, we're not. Again, it's just frankly, it's sad that report in their 6-year projection, none of it talked about the benefit of human life. All of it talked about how do we improve services that we already have.
And that,
Okay, I'm glad you have all these big key players. I'm like, that's fantastic. But I want people to live longer and live happier for that length of time.
Yes.
And disease-free.
And we want people to sign up for Turtle.co.
Yeah, we want them to sign up to Turtle.co, and I want people to worry about themselves, their children, and their children's children. And that's about coming together, sharing that data, and using that collective power to increase that quality of life.
Yes, because that's what we're about. Quality of life.
Quality of life.
Turtle.co.
Thank you very much. Please sign up.
Thank you for listening to TartleCast with your hosts Alexander McKeag and Jason Rigby, where humanity steps into the future and source data defines the path. What's your data worth?